something I'd love to hear from both of you would be, what are you seeing next? What's coming down the pipeline?
I'll jump in, go first on this one. So I think something that's been on our radar at SGRX that I'm not sure a lot of organizations or clients are aware of is the opioid settlement disbursement. So currently the federal government is sending each state funds from the settlement from drug companies like Purdue and Mallinckrodt that were required to pay out, as a result of the opioid overuse epidemic. And so we have programming in place already to assist the municipalities that are in receipt of those funds, help their members that are affected.
Well, that's really great. Yeah. What do I foresee? I think there's always the next wave of drug, right? That's going to be a problem, right? We talked about insulin was going to bankrupt, and then it was the biologics, and now it's the weight loss drugs kind of a thing. And so I'm always interested to see how this one plays out and what the next one is. Regulation, I think on the federal side, there's lots of talk, but I don't see a lot of changes in the federal regulations. I don't think that we're able to change much on a federal level these days, but I've seen states get very active in trying to regulate PBMs and a lot of the things that work through PBMs, rebate spread, those kinds of things. So it'll be kind of interesting to see what happens there. And then utilization, obviously, I'd like to see what, we finally seen a plateau of utilization after several years of dramatic increases in the rate of utilization. So it's, it's kind of like a velocity of change that's been happening. So it's been kind of interesting to see that happening. And frankly, I think there's innovative people out there that see a system that, everybody says it's broken. I'm going to say it could use vast improvement. and I think they're trying to figure out ways to make that happen. I think that you may see some in technology. I'd like to see more happen in technology. But it'll be interesting to see what happens. It's never boring.
It's not boring. And just one thing about what Vikki had mentioned with the opioid epidemic, I just think it's still so relevant. I know that in Michigan, every day 8 people actually die from opioid abuse. So that's definitely on the forefront of my mind, and I think all of our minds, just to try to get that in check.
And just a really quick humble brag, I don't know if you're aware of this, Russell, but SGRX is the only PBM in the country that is compliant with the Michigan non-opioid directive. So, it's much like an advanced healthcare directive. Mm-hmm. So folks, if they have to go into the hospital for any reason or even just receive care from their primary care physician, can sign the form ahead of time and say, please try every other modality possible before jumping to an opioid. So.
I think we should talk about that some more. I'd like to see how we can implement that into our groups as well. So that would be interesting. You guys know, because we worked with you on our opioid policies in the past, of how we try to reduce that, and with limiting, scripts and things like that, and doctors and, number of doctors prescribing for the same member, some of those kinds of things. But I'd love to see what's going on there.
Absolutely. Yep. Yeah. And we can help you too, look for the funds that are coming down from the federal government too, to help fund some of those maybe medication therapy management programs.
That'd be interesting. Yeah, we actually work with several cities, counties, schools, school districts, I should say, universities, things like that some of those are probably have potential to receive some of those funds. And so it'd be good to be able to be that partner with them on that side as well. Yeah. So, thank you.
As we wrap up PBMT, I feel like it would be a disservice to have two people like yourselves in the room and let you go without hearing your thoughts on just some random topics that are on your mind these days. Not just the questions that we're asking, but what's on your mind as far as this industry?
I started in the industry 28 years ago, and pharmacy wasn't always high on my mind of what's going on in the industry, but then realized it's obviously one of the biggest areas of concern as we go forward. And I had mentioned earlier that talk of unsustainability has been around since I got in the industry way back then, and yet somehow we're still here. But it's really hard to think that we can continue the way we are now without some significant changes. Costs are too expensive. If you think about the average cost of a new drug, just in the last few years, 4 or 5 years ago, it broke over 100,000 as the average list price of new drugs. And then it went to 150, and it's over 300,000 now as average list price now. So you start thinking about those kinds of costs, and that's for yearly treatment, right? And you start thinking about those kinds of costs, and you just got to go, how is it possible that we're all going to be able to keep paying for this? So I think there's got to be changes in this industry. And if we don't change it from inside the industry, it's going to be changed from outside the industry. So we have an opportunity and a responsibility to actually make changes and make this a better, more sustainable industry.
So I guess from the PBM perspective, we appreciate partners like yourselves and organizations like Merck Cuban for being the change, really, right? So it's easy to talk about all of these alternative programs, but actually implementing them is another thing altogether. And we've got a proven track record of putting programs in place year over year and kind of flexing with the market depending on what is coming down the pipeline. So for us right now, what we're seeing everywhere is AI, right? How can AI be harnessed in a way that is, still allowing us to maintain that humanistic culture that both of our organizations pride ourselves on. And so for us, at least, that's an area where we're being very, intentional how we implement it. We're doing it very cautiously, but judiciously. So I'd kind of like to hear what Motive's approach is with AI.
So we have a head of IT or technology in our organization. One of the very first people that was brought on back in before, literally when we just barely had a license, right? And he's always had an eye to AI. We have some other senior leadership that has worked in the AI space and the technology space that have also brought some of those things to bear in our company. So we actually, with all the coding that we do, we have a lot of developers, and the coding that we do, we actually utilize AI in a lot of that. One of the initiatives now is to actually take one of those technologists of sorts and embed them in each of our departments and actually try to figure out what is it that AI can do in this space, right? And so if you think about underwriting is one of those places where we deal with so much data and calculations and things like that, if we can have AI help us with some of that, but then still have that human eye involved in pricing. Another place is, if you think about utilization management, there's AI already on the other side that they're already going, here's what you have to include in your request for services. And so you have AI writing that. And so you have to have AI on the other side, literally, to combat that, to make sure that what they're submitting to you is accurate. And so I think we're going to see that all over the place. I think utilization management on the pharmacy side, I think that's going to, if you guys haven't seen that already, I think that's going to be happening. I think we are seeing that. So AI it's a tool, right? And so it'll be used for you or against you. You got to figure out how to make it work for you. And so we're already doing that.
Agreed. Yeah, so on the PBM side, I think AI has been in place for decades, really. If you look at things like electronic PA, for example, decision tree logic has been used all along to kind of improve inter-rater reliability scores, for example. So, we at SGRX really pride ourselves on the fact that all of the individuals on our team are either licensed pharmacy technicians or licensed pharmacists. So, we believe it's our responsibility to continue to bring that clinical integrity to our clients like MotivHealth so that you can focus on innovating in different ways.
Russell, so you've shared that Motive's clients have realized millions in savings through these programs that we've discussed. Can you share an example of how that translated into value for those that you serve?
I'm glad you said it realized millions of dollars in savings for our clients, but also our members. So if you think about it, always you help a member first. I've said that a million times, so I know a broken record, but you help a member and that helps the client group. And our costs, our pharmacy costs run about 40% of the industry average. So we're saving about 60% for clients, which is great. But even better is we're actually saving about 75 to 80% of the normal out-of-pocket costs for members. So our out-of-pocket costs running, 20 to 25% of what they would under another plan. And so that savings to real people has real meaning. And so one of the stories I share all the time, because this one means a lot to me, was, with our diabetic programs that we had, and there's this lady that called in, and this isn't the only time that we've had people crying, tears of joy, to talk about their situation. And for this lady, she was a single mom, had 2 kids that were diabetics. She was working a second job just to pay for the diabetic medications for her kids. She was that dedicated to make sure that they were taken care of. And we removed all that cost from them. She was able to quit that second job and spend that time with those kids. And so to me, that one matters a lot to me. That means a lot to me. And we're lucky enough that we have what we call Motive Moments, where people call in and leave messages about their experience, their personal experiences. And some of them are amazing. I mean, just amazing that the impact that you can have on people's lives by helping them take care of themselves.
It's an amazing story.
It's very touching.
Yeah, it is actually. Yeah.
Kind of speechless.
Yeah.
But I do want to ask you about sustainability, right? We've talked a lot today about innovation and implementing programs that meet the moment. Kind of how do you see these programs holding up long term?
Yeah, so, we have multiple programs, obviously, that we go through to help save people, to help save members money. And I think those programs are sustainable, and I could go into each one and explain why I think each one's sustainable, but it's not good enough. We actually, and this is something, conversation I've had internally for years is that, yeah, we've done this, but we have to keep going. We have to find the next way to help people, and then the next and the next. This isn't, we're done. Hey, we crossed the finish line. It's just this constant. You have to keep moving and try to find better ways to help serve people. So it's for me, it's not sustainability as much as you got to keep going. There's way too much wrong with our system. That we're not done. We're not done yet. So we talk about, what we see as having to continuously get better. How do you see things? How do you see things? How is Script Guide going to continue to help people control costs and maintain the health and rights of your members and our members?
Great question. So, as a clinician myself, it has always been part of the fabric of the organization to ensure that all of our decision making, including, from a programmatic level, ensures the best interest of the member, the end user, if you will. And so clinical integrity is always at the forefront of that decision making process. We talked about our pharmacy and therapeutics committee at length. So all of the programs and decisions that are made are vetted through that committee before they're implemented. In terms of the flexibility and innovation, we take what's called a pharmacy triage approach. So, we talked about the Mark Cuban Cost Plus program. We talked about international pharmacy. We have 340B programs that we can leverage. We do a discount card marketplace. So it's really different levers that can be leveraged, if you will, depending on the needs in that particular moment. But, I think, like you mentioned, Russell, it's difficult to predict what's going to come next. 10 years ago, we would never have guessed that Mark Cuban would be part of the solution to the healthcare crisis we were facing. So I think that's where SGRX particularly, we're in kind of a David and Goliath scenario. So we have the ability to pivot and be flexible and, help partner with clients like Motiv to meet those needs as they evolve.
So thinking of future disruption, because SGRX and MotivHealth are two companies that the things that aren't broken in the industry, because there are a lot of things that are not broken in the industry, but two companies that do those things very well. But then when we talk about disruption and what's coming next, Russell, I'll turn this one to you first. Do you think it's that disruption? Do you think it's going to come from legislation? Is it going to be tech-driven, member-led, or something else?
It'd be great if it was member-led, but I don't know how that would happen. We have had members that have led us in some directions, and we're happy to let them do so. But when I think about the changes that are happening, if I was to bet on between the three, I'd probably say technology. I think that's the one that's most likely to help both costs and outcomes going forward. And we've seen some programs out there, is one that we're working on now with Waltz Health and some others that are out there. So I think there's a lot of smart people figuring out how to make tech work for people. And I think that's great. Legislatively, I think states are trying to drive a lot, but I think they're limited in their ability. And I don't know if they're always going in the right direction. So, and then on the federal end, I just don't see much change happening in legislation on the federal side. So members could surprise us, right? I mean, if you look at like insulin and the grassroots that they did that helped drive insulin costs down, that was interesting to watch. But that's more rare than, that's the exception, not the rule for sure. But I love it.
I think we have a real opportunity right now with the GLPs to engage members more. One of the things I love most about working with Motiv is the integrative approach to, management of lifestyle, diet, and exercise that you all take with your membership. And those medications, in the literature, it shows that those components are necessary for success. They're not optional. And we've partnered to come up with criteria that require those pieces to be in place before the medication will be covered.
If you could wave a wand and fix one thing about the pharmacy benefits space overnight, what would it be? Russell, how about I have you answer first?
So I would say probably transparency throughout the whole system. So all the way from pharmaceutical companies and all the different things that they do to the PBMs, to the plans, all the way through. And I think that if everybody understood that whole process, we could actually start working on the real problems in the system. So for me, it's just everybody would actually understand how all this actually works first. I have a lot of other ideas to do with that magic wand as well, but I'll start with that one.
Perfect. Vikki, how about you?
Yeah, I would say I would like to see pricing controls. So, as with the weight loss drugs that we talked about earlier, they have the ability to devastate the economy, much like the Sovaldi and Harvoni did a decade ago. And then, the rest of the industry flexes to meet that. And, we scramble to stratify people who needs the most. So really that, I think, is the starting point for all of the other pieces of the system that are broken.
Great. The last question that I have for both of you, what's one trend or shift that you think every payer needs to have on their radar right now?
I'll let you go first.
Okay. I think the highest on my radar probably is just utilization, watching utilization trends. We've seen, there's always going to be the next wave of a type of drug that's going to take over the whole system, right? And I loved how you said how the whole system has to conform and bend to deal with that issue, right? The Harvoni or the biologics and things like that. There's always going to be something happening, but I think in general, our utilization of medications and other services have just been skyrocketing, and I think that's something that everybody's trying to come to grips with still. So that's still one of the highest things that stays on my radar.
Definitely transparency. We're seeing, especially in the PBM industry, it's being legislated many places. And, fortunately, SGRX has always conducted business that way. So it won't be a big paradigm shift for us. But I think it's in the best interest of the members that all of the players in PBM and health plan markets function in that way.
Perfect.
I do think that's somewhat of your advantages, having come from the Medicaid space that was state and federally regulated so heavily that all the extra regulations, you're already there.
Absolutely.
That is a definite advantage.
Great. Well, those are all the questions that I have. So I think from here we'll wrap it up. Thank you so much, Vikki. Thank you so much, Russell. I think this is, for anybody who watches, it's going to be very beneficial and educational for all of them. So thank you so much.
Thank you.
Thank you.